much will you pay for Medicare Part B premiums in 2022? The question on everybody's mind right now is, will Medicare reduce Medicare Part B premiums for the rest of 2022? Over a month ago, there was a lot of talk about Medicare revisiting that big Part B premium jump from 2021 to 2022. It went from $148.50 per month in 2021 to $170.10 per month in 2022 for most Medicare beneficiaries. Unfortunately, since those reports in January, there has been silence from Medicare. It is still possible that those Part B premiums will be reduced. If they are, we will be very happy to make a new video. For now, this video will take you through the Medicare Part B 2022 premium costs as they stand today, broken down based on your income. Hi, I'm Tabitha Moldenhauer, broker with Benefit Consultants Midwest. If you haven't already, please take a second to hit the subscribe button. We have new, helpful Medicare content every week. Medicare Part B is Medicare outpatient coverage. Even if you worked and paid Medicare taxes for 40 quarters and are eligible for premium-free Medicare Part A coverage, you still do have to pay a premium for Medicare Part B. If you receive Social Security, your Medicare Part B premium will be automatically deducted from your monthly Social Security deposit. If you are not yet receiving Social Security, you will receive a bill for your Medicare Part B premiums. You have some options when it comes to paying those Part B premiums. There's a link in the description that will give you more information on those options. Most people pay the standard Part B premium, which, as I said, this year is $170.10 per month. If your modified adjusted gross income from 2 years ago is above a certain limit, you will pay the standard monthly premium for Part B plus an added income-related monthly adjustment amount, also known as IRMAA. IRMAA is an extra charge that gets added to your premium. The chart on the screen shows how much you will pay based on your income. Please note that 2022 IRMAA payments are based on your modified adjusted gross income from 2020. If your income has gone down since 2020, you can request an appeal of your IRMAA decision. There is a link in the description to the form that you will need to use to file that IRMAA appeal. There are a couple other potential complications with Part B premiums. If you didn't get Medicare Part B when you were first eligible, your monthly premium may go up 10% for each 12-month period that you could have been enrolled in Medicare Part B but were not. In most cases, you'll have to pay this penalty every month for as long as you are enrolled in Medicare Part B. Usually you don't have to pay the late enrollment penalty if you meet conditions that allow you to sign up for Medicare Part B during a special enrollment period. One of the most common situations that qualifies you for a special enrollment period is leaving an employer group health plan to enroll in Medicare Part B. This special enrollment period is for people who continue working past age 65. If your employer group health plan has more than 20 employees, you can decline Medicare Part B when you turn 65 and wait to enroll until you leave your group health plan. In that case, you will not have to pay the late enrollment Medicare Part B penalty. If you are on a small group employer health plan, you may have to enroll in Medicare Part B at age 65. So definitely check with your benefits administrator 3 to 6 months before the month of your 65th birthday in order to find out whether or not you have to enroll in Medicare Part B when you turn 65, or if you can safely delay it until the time when you leave your group health plan. If you are concerned about timing your Medicare Part B enrollment, please see the video that's linked above that explains it in more detail, or give us a call at 877-312-1414. We can help you understand the special enrollment periods, especially those available for people who are working past age 65. If you have low income, you may be able to get help from your state in paying your Medicare premiums. In some cases, Medicare savings programs may also pay Medicare Part A and Medicare Part B deductibles, co-pays, and coinsurance amounts. These get somewhat complicated, so I am including a link in the description to more information. If you have questions about your Medicare coverage, please feel free to give our office a call at 877-312-1414 or visit bcmwi.com. We are here to keep you updated on your Medicare options so you can find the best possible coverage for you. Have a great day.